Welcome to Both Sides of Beehives. I'm Beth Ives, and I'm really glad you're here. As a neurodivergent and disabled social worker, I'm constantly trying to make sense of the world around me, understand the themes that are impacting my clients, and relate them back to my own experiences. Growing up and early on in my career, my reference point or idea of what disability looked like was folks who had pretty significant needs, who might have dealt with limitations that impacted a number of areas in their life. And I didn't really understand that there was folks who were disabled that might blend in, or they might have disabilities that were less obvious to me as an outside observer. What I've figured out in the decade or so of being disabled is that it can be a debilitating event or a life-altering circumstance that someone is born with or happens to them that makes them become disabled. For a lot of folks, though, it is slow, it happens over time, it happens incrementally, and that was my experience as well. Disability involves so many different facets of a person's life, and there's so many pieces that can make it easier or harder to deal with, oftentimes because of how folks around us feel about it versus how we feel about ourselves. And that was something that I had to sit with because I felt that the way it was impacting my life, the way that it was hindering different social experiences, making work difficult, the way I had to start being more mindful about what I did with my time after previously having no regard for how little sleep I could run on. I had to figure out, can I be okay identifying in this way? What does it mean if I take on that label for myself, but no professional or expert gives it to me? And I now understand that lived experience is an expertise, and that it isn't always folks with different credentials that are the ones that get to decide that for us. But at that time, I was so concerned with not taking something or identifying with something that would somehow dilute or sanitize the experience of other people who had different disabilities from me. I have what many people would consider an invisible disability. And it's important to note that just because we call it invisible doesn't mean it's invisible to me or to folks who are looking for some of those clues. When we say someone has a visible or invisible disability, it is based on the perception that society or strangers might have about that person based on what they think disability is. Oftentimes, it includes the accessibility accommodations and different access needs that a person has that we consider to be more obvious, more observable. And when we don't have those needs, it can be harder for folks to realize that we are disabled, which makes it hard for there to be visibility about it. I explain this concept as having able passing privilege, or meaning that I look like someone who is able-bodied, which means that I don't experience some of the discrimination and some of the stigma that other folks with a visible disability can't help but experience, because there is not a way for them to decide if they out themselves as being disabled or not, as their body obviously and naturally does. I sometimes liken it to being a bisexual woman who's in a relationship with a male. It is seen that she is in a heterosexual relationship and is straight passing in theory because it looks the way that we understand heteronormativity to look like, when in reality she has a different identity and wants and needs and is part of a larger community, but it is not obvious at first glance, which can give her protection in certain circumstances, but also can add a lot of conflict. It can make it challenging to understand her sense of self, or more importantly and critically, where she fits in the world, because she has experiences that are both more privileged and more circumstantial that not everyone can relate to. As a white disabled person, I don't experience the world the same way that a Black or person of color who has a disability might experience things. And so I'm very mindful about contextualizing my experiences within the broader society and all of the different ways that we can be oppressed and have privilege within this world. Another way that I think my existence or specific list of disabilities can make it confusing for folks to understand what it's like to live in my body is because I, of course, have competing needs. I have my personality, I have my trauma and PTSD symptoms from my upbringing. I also have my disabilities that require different accommodations from me. And sometimes they're in conflict with each other. A great example of that is concerts for me. As an ADHD person, I love getting to feel the vibrations of the music, getting to feel everyone around me just vibrating in a buzz. It's a way for me to stim in a way that is socially acceptable, and I can dance and move my body in ways lots of folks are around me. And so I feel very seen. It is some of the greatest joy that I feel. But because of my post-concussion syndrome and my chronic migraine disorder, swaying, moving side to side, dancing oftentimes makes me very nauseous. And so when I do go to a concert, it's very cup filling for me, but I have to take my anti-nausea meds beforehand. I might have to put on my wristbands to help with my symptoms. I might have to cancel work the next day or plan ahead and not schedule any clients, or make sure I don't have any plans for the next day because I know how debilitating it can be for me. A couple weeks ago, I went with a friend to a concert and was reminded that as a disabled person, I have my chronic disabilities that I live with every day, and they might be in remission or be dormant, or they might be in a flare. It might depend on the day or the hour or the minute what my symptoms and abilities are. But then there's the acute disability that lots of us encounter. And so because I sprained my ankle 3 weeks ago, I found myself on crutches going to the concert, trying to accommodate how do we get to our seats? How do we make sure I have enough energy to get from our hotel room to the venue, given how slow it is for me on crutches, how much more painful it is, how many more spoons it requires of me? And then I add on all of the accommodating that I naturally have to do because of my other diagnosis. And it was a reminder that we have to take all of that into account. Like many disabled folks, some of my disabilities also make me more susceptible or more vulnerable for certain acute injuries or disabilities to compound my already chronic disabilities. So in my case, because I have something called classical Ehlers-Danlos syndrome, my joints are very loose. My tendons and ligaments and everything is basically hanging on for dear life. It means that my muscles are always tense and working very hard to keep everything stabilized because the joints and connective tissue that most people would rely on to keep themselves upright and stable are not things that my body can count on. This has been on my mind even more so since spraining my ankle, since this is roughly my 16th ankle sprain. And unlike most folks who tend to have an injury in one part of their body or in one specific side of their body, I have sprained my ankles roughly 50-50. And that is because of my classical EDS. It is in all of my ligaments and all of my joints. And so this time I sprained my left ankle, that tends to be worse for me. But in terms of how it heals, in terms of how vulnerable my body is to just rolling my ankle from walking as I was, this is something that I live with. Whereas most folks could rest and ice and compression and elevate and be fine after a few days, 3 weeks in, I'm still struggling to walk properly. I'm still dealing with a lot of swelling and pain and discomfort because this is how my body is designed. It is likely to stretch and pull apart at any given chance. And so doing an injury that for anyone else would be inconvenient, but ideally short term, is something that I encounter often and now have to deal with on top of my chronic disabilities. In another way, I also have to be mindful about how different disabilities present for me. As an extroverted disabled person, I am very busy at baseline. I spend a lot of time connecting with my clients and my loved ones. I love doing extracurriculars and traveling and all of that good stuff. And so when I pull back because my PTSD is flaring or my thyroid is out of whack and so my depression has taken a plummet, it might not look the same way it does for other people. It might look like they're normal. My secret introvert husband would love to maintain the level of activity and busyness that I might experience when I'm at my absolute worst. And so being able to articulate that to folks, being able to communicate to my people that this is what it looks like to me when I'm in a flare, and these are what the signs are that I look for in myself, is critical because just one person having one disability is not representative of what everyone with that disability looks like because of our other identities, our personalities, our conflicting diagnosis. It can also be common for different medical professionals to be recommending conflicting and competing advice, which can make it really confusing as the patient to know, how do I implement this, especially if we're struggling to validate ourselves. So on one hand, with my POTS, my posterior orthostatic tachycardia syndrome, I have to be really careful about how much physical activity I do because my heart rate jumps so quickly now. And it's not due to a lack of conditioning. It's not because I'm out of shape. It's because this is the condition that I have probably always had, but has been exacerbated by getting COVID. But on the other hand, I also have post-concussion syndrome, and part of dealing with that is trying to push your window of tolerance, trying to see what your body is capable of, and returning to sport. But then, because of my chronic migraine disorder, the pounding of running on the pavement is not possible for me now because it flares my symptoms beyond a place that makes sense for my body. And then I layer in my PEM from my chronic fatigue syndrome, and all of a sudden, all of these needs, the things that could help one, exacerbate the other, and I'm left looking at the Venn diagram of what is going to be the thing that causes me the best comfort, the best quality of life, when there isn't one simple answer. This is why validating our own experiences and encouraging our loved ones and the people around us to see us as the expert of our own experiences is so important. When I tell someone that I am out of spoons, I'm out of capacity, I need them to believe me because I'm already working within my threshold. I'm already taking an inventory all day long of how much capacity do I have? How much energy do I have? Did I sleep last night? Was I able to eat at regular intervals today? Did I take all of my medications at the appropriate time? What baseline am I starting out with? And that will help inform what I'm able to do for the rest of the day or the days to come. But sometimes there's triggers that we have no control over. The weather makes it really bad for my chronic migraine disorder. And so as much as I love the springtime and it is so good for my seasonal affective disorder and getting to smell the flowers and seeing everyone come out of hibernation, it also tends to be when my migraine symptoms flare up and I'm in more pain. And some days the joy of getting to experience that outweighs the points that it requires of me, or having to rest, or having to take my acute medications to help manage my symptoms. But sometimes it's not worth it, or it's not possible. But I think it can be hard for folks to figure out what the pattern is or what the method to the madness is, mainly because I'm still trying to figure it out myself. It was really interesting with being on crutches for the better part of the last 2 weeks and having folks move over, offer grace, suggest taking an elevator, different accessibility accommodations that I was now entitled to because I had a visible disability. And it's so interesting because it is an additional acute injury that I was dealing with on top of my chronic difficulties. However, it wasn't necessarily the most debilitating symptom I was dealing with in that moment, but it was the one that was more universally recognized by the people around me, and I appreciate that accommodation so much. That grace is so helpful, and it also helps me to have it for myself. But I'm also working at allowing the people around me to know that I still struggle with those things. I still need those accommodations and that thoughtfulness, and to honor it for myself and be believed when I ask for it, because I exist in this body all of the time. I think a barrier why sometimes folks struggle to believe what I experience or to fully understand it is because they don't want to. Not because they're some horrible person, not because they don't inherently believe me, but I think we want the people we love to be well. We don't want to think that they struggle and have a hard time, or that they are experiencing significant pain and distress behind the scenes. And so sometimes we can limit our understanding of what they're going through. We might try and close our ears to what they're telling us. We might try not to notice some of the pieces that are going on because we don't want it to be true. But that doesn't actually get rid of the reality of what they're experiencing. Regardless of if a person wants me to be disabled or not, I am. Regardless of if someone tries to toxic positivity it, or try and just make it okay, or tell me to look on the bright side, it still doesn't change the symptoms that I live with. And the more that I can validate my own experience, the better my quality of life actually is. I'm not embarrassed to have a disability. Like most people, it wasn't something that I asked for or caused. And even if there is blame or responsibility or fault for how someone becomes disabled, that doesn't change their reality or that they're deserving of our empathy and our concern and our consideration.